Hi, this is Dr. ROJoson, Director of ROJoson PEP TALK. My PEP TALK today is entitled Patient Management Process, Paraclinical Diagnostic Process. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this PEP TALK on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment, and I am now on my third module, which is entitled Patient Management Process. What I have in mind in my PEP TALK, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. That is my key performance indicator. I hope you will be in my group of 30. This is the patient management process framework. The module on patient management process has 6 parts, namely overview, clinical diagnostic process, paraclinical diagnostic process, selection of treatment process, advice to patient process, and peculiarities and limitations of medical practice. Today, we will be focusing on this part, paraclinical diagnostic process. As I said, we will be focusing on this part of the patient management process, the paraclinical diagnostic process. The takeoff point for paraclinical diagnostic process is the clinical diagnosis, which consists of the primary and secondary diagnosis. After the clinical diagnosis, the next step is to determine whether a paraclinical diagnostic procedure is needed or not. A paraclinical diagnostic procedure is a diagnostic procedure that is done after the clinical diagnosis is arrived at, and its objective is to make the diagnosis more definite. The foremost indication for a paraclinical diagnostic procedure can be stated this way. If you are not certain on the primary clinical diagnosis, and you need to be more certain or more certain before treatment, then go for a paraclinical diagnostic procedure. To decide on the indication of the paraclinical diagnostic procedure, the physician uses 2 processes. One is the degree of certainty on the primary clinical diagnosis, and 2, comparison of the treatment plans for the primary and secondary clinical diagnosis. A physician should consider the following factors: how certain he is with the clinical diagnosis, and whether a more definite diagnosis is needed or not for some reasons for another. How certain is he with a clinical diagnosis? If he is quite certain or very certain, in general, a paraclinical diagnostic procedure is not needed. The quite certain clinical diagnosis becomes automatically the pre-treatment diagnosis. If he is quite certain or uncertain, in general, a paraclinical diagnostic procedure is needed. In general, a clinical diagnosis is said to be quite certain if it is based primarily on signs that are reinforced by the symptoms and prevalence data. A clinical diagnosis is said to be uncertain if it is based primarily on symptoms and on prevalence data. On whether a more definitive diagnosis is needed or not for some reasons or another, if the contemplated treatment procedure is mutilating, risky, etc., then a more definite diagnosis is needed. If the treatment for the secondary clinical diagnosis is the same as that for the primary clinical diagnosis, then a paraclinical diagnostic procedure may not be needed. If it is different, then a more definitive diagnosis is indicated. Illustration: Certainty of primary clinical diagnosis, if it's just 60% to less than 90%, which is not certain, then you need a paraclinical diagnostic procedure. If it's 90 to 99%, which is categorized as certain or quite certain, not needed. Treatment plans for the primary and secondary diagnosis, if it's the same, as a rule, not needed anymore. Another illustration, 98% degree certainty for the primary, 1 to 2% for the secondary, treatment plan, surgical for the first primary, and then non-surgical for the secondary. Is a paraclinical diagnostic procedure needed? No, because of the high degree of certainty for the primary, even though the treatment plan for primary and secondary are different. Another illustration, 60% for the primary clinical diagnosis, 40% for the secondary. The treatment plan is surgical for the primary and non-surgical for the secondary. Is a paraclinical diagnostic procedure needed? Yes, because of the degree of certainty of uncertain for the primary, and then the treatment plans are different. %60 for the primary, 40% for the secondary. This time, the treatment plan will be the same. So there is no need for a paraclinical diagnostic procedure anymore. 90% for the primary, but the treatment will be a mutilating operation. So even though the degree of certainty is high, but because of the mutilating operation, there is a need to go for a paraclinical diagnostic procedure as a rule, unless there's a strong reason not to do so anymore. 70% for the primary and 30% for the secondary. Chemotherapy for the primary, radiotherapy for the secondary. Okay. Is a paraclinical diagnostic procedure needed? Yes, because 70% is still low, not certain, and then the treatment plan for the primary and secondary are markedly different. One is chemotherapy, one is radiotherapy. Here is a tickler that will stimulate you to think, which of the following statements is the strongest indication for a paraclinical diagnostic procedure? 1, you can never be absolutely certain of your clinical diagnosis. You want to confirm a clinical diagnosis which you are already certain of. You want to document a clinical diagnosis which you are certain of. And when you are not certain of your clinical diagnosis. So which is the best answer here? The best answer is D, when you are not certain of your clinical diagnosis. So that's the indication for the paraclinical diagnostic procedure. After determining whether a paraclinical diagnostic procedure is needed or not, the physician advises the patient on this by explaining the processes that he uses in the outcome of his analysis. He recommends, weights, and answers queries for the patient and allows the patient to decide, and then forges a shared agreement. If there is a need for a paraclinical diagnostic procedure, the physician uses the BRCA processes. B stands for the benefit, R, risk, C, cost, A, availability. The physician gives or lists the various options of the paraclinical diagnostic procedures, then gives the data on the BRCA. With the data given, the patient is asked what he prefers. The physician tabulates, compares, and analyzes the options on the BRCA data like this. First column are the options. Second column, the benefit, which means what is the goal, based on the goal to be more definite on the diagnosis. Then risk, cost, availability. Illustration 1. Okay. So most direct benefit for the option 1 indirect for option 2 and 3, and then the risks are all acceptable for the 3. The cost is 1,000, 1,500, and 1,000 respectively, and all are readily available. Which one is the most cost-effective procedure? Option 1, because it's the most direct and it's the cost is only 1,000 compared to 1,005. Yield more than 90% for option 1, 90% option 2, 80% for option 3. Acceptable risk for all 3, 4,000, 4,000 for option 1 and 2, and then for option 3, 3,000. All are available. Which is the most cost-effective procedure? Highest yield is option 1, and then its cost 4,000, the same as option 2. So option 1 is the best answer here. At this point, the physician should be explaining the processes of the selection BRCA to choose the most cost-effective paraclinical diagnostic procedure and to the desire of the patient. He can recommend, he awaits and answers queries from the patient, allows the patient to decide, and forges a shared agreement. Once a shared agreement is arrived at, an informed consent or informed refusal is formalized. If there is an informed refusal, the paraclinical procedure is not executed. If there is an informed consent, paraclinical diagnostic procedure is executed. And just before, during, and right after the paraclinical diagnostic procedure, the physician advises the patient on the preparation, possible outcomes, and things to monitor, etc. Assuming that the paraclinical diagnostic procedure is done, the physician now has to interpret the results of the paraclinical diagnostic procedure. To do this, he uses two processes: assessment of the accuracy of the report and correlation with the clinical findings. If he finds nothing unusual in the reporting of the result, he goes on correlating the result of the paraclinical diagnostic procedure with the signs and symptoms of the patient to come out with a pre-treatment diagnosis. If the result of the paraclinical diagnostic procedure is congruent with the primary or secondary diagnosis, the decision should be to accept. If incongruent, he makes another decision, hold or to accept despite the incongruency. Another tickler for the interpretation of the paraclinical diagnostic process to come out with a diagnosis, determine which paraclinical diagnosis should be accepted as a pre-treatment diagnosis and which one should be put on hold for further decision making. A for accept, H for hold. Paraclinical diagnosis is the same as the primary clinical diagnosis, accept. Primary clinical diagnosis is the same as the secondary clinical diagnosis, accept. Paraclinical diagnosis is a clinical diagnosis least considered, hold for a while. Paraclinical diagnosis does not jive with the clinical picture or the diagnosis, hold. At this point, the physician advises the patient on his interpretation and proceeds to the discussion of the treatment. I will end this pep talk at this point because this is the end of the paraclinical diagnostic process, and we'll discuss the subsequent steps in the patient management process in other sessions. Takeaway in this pep talk that are related to patient empowerment. So at this point of the pep talk, understand the patient management process framework in terms of what the physicians are doing and should be doing in the paraclinical diagnostic process. Be ready to ask questions based on the requirements of the processes, particularly on the physician or when a physician is not using the processes or is not clear and full in explanation. Participate actively and fully in the problem solving and decision making of your health concerns with your physicians in coming out with the most cost-effective paraclinical diagnostic procedure and to your desire. And lastly, master the paraclinical diagnostic processes as they may help you in some way in deciding for your own health concern whether there is a need for a paraclinical diagnostic procedure, and if yes, how to choose the most cost-effective one and to your desire. And this is one other way of gaining greater control in your health concerns and issues. So I end this pep talk entitled Patient Management Process, Paraclinical Diagnostic Process. I hope I have empowered you to have a better understanding of the paraclinical diagnostic process in the patient management process. So with that, I say thank you for your kind attention and mabuhay kayong lahat.